I'd like now to move over to Jenny Hartnoll from Frome in Somerset in the southwest of England. So Jenny, over to you.
Hi, thank you. Thanks, Jim. Thanks for inviting me. I'm going to do a whistle-stop tour of our work that we do here in Mendip, which is a part of Somerset. If you see the image in the top left-hand corner, Somerset has a population of over 900,000, and Mendip is a district within Somerset. So the team that I work in, we work with a GP practice population of 118,000 people. So the team that I work with is employed by GP practices. So we are part of the GP practice team. The work I'm going to talk about today is in Frome. We have a market once a month. The whole town is closed down. There's a huge amount of sort of social capital already in Frome, and we have a GP practice, one single GP practice, which covers Frome. On the site of Frome Medical Practice, it's an amazing building. We've got space for community groups to do groups in. We've got a space downstairs where we have volunteers meeting people, signposting people to support. So the work we do is already established in a town that has a great amount of social capital. As Jim and Nikolai said, the background to this work was a GP, Dr. Kingston, saying, this image here with the wavy line is somebody, the green line is somebody living with a long-term health condition. Sometimes they're feeling fine, the top of the curve, sometimes they're not feeling so well. And so often in the past, we focused on the times, those red bits in the middle, when someone goes to see a GP or has time with social care, and that's 5 to 10 hours a year. But how about those other 8,000 plus hours in a year where we're actually living our life with our friends, with our family, at work, in our community? And how about shifting the focus to actually that precious time that we do spend the majority of our lives out there just living our lives? Also, this is the sort of similar side to the one that Jim showed earlier on, that in the past we focused on physical activity, on alcohol consumption, on smoking. Of course, that's important. But actually, let's also shift the focus and shine the light on the importance of those social relationships and the impact they have on how we live our lives, and also the risk of mortality. A GP said to me, Dr. Kingston said, I want to know what's going on in the community. I want to be able to use that power of those communities with the people that come to her, because she recognized it wasn't just all about giving someone a pill. I'm not saying that's all GPs do, sorry, but actually the power of the communities alongside that sort of traditional work that GPs might do. What happened was that Dr. Kingston employed me, and so the first hexagon, which was about us finding out about all that huge value that there was out there in the community, all those amazing community groups, as Nikolai was saying, things like that football for people with prostate cancer, the men's shed, the exercise groups, the carers groups, so mapping everything that was out there. So we had one place on our website where people could find out about that information. We linked our website in with the GP system. So when a GP was with a patient, they can just press a button, it brings up information on our website, and then that's coded in the GP record that they've been able to support that person to access that support in the community. So it's coded in the GP record. So it gives that parity of importance to the sort of medical side of things, to actually we're linking in people with social support. So people now call it social prescribing. We didn't used to call it social prescribing when we started. It was just let's link up with the community. But the GPs can have that and give that information to somebody they're working with, almost as a prescription. But it's not saying you ought to go to this group. It's saying have a look at what's out there. Have a look at all the wealth of the information that's out there. So this is all about those simple signposts. It's about those simple signposts can happen via a website. Anyone can access that website. A simple signpost can happen with a GP giving that information. And this, the first column, the bottom hexagon, is about, let's not just rely on a website, let's not rely on a GP or going into a GP practice. Let's communicate what's out there via social media, via radio. We have radio slots, via newspapers, but also people can call us up and find out what's going on in the community. We also recognise that when we're out there working in the community, there are loads of people who want to set loads of things up in the community. Sometimes we step in and we can help people, but other times it might just be somebody coming to us and saying, how about this idea, and us saying, fantastic. So it's not about us taking control and making sure that we know what's going on there and taking power of setting things up. It's about us kind of being with the community and working alongside the community and stepping in when we're needed. So once again, we map what's out there. We have that website, we have the social media, and we also realize that people want to go to a physical place to find out what's going on in the community. So that's where our talking cafes come in. So people who might not have access to a website, who might not be on social media, who might not want to call us and say, where's the nearest exercise group or where's the nearest carers group, they can come to a talking cafe, meet one of our team, meet other people who have been in there before and say, for example, where's the nearest carers group? They can be signposted then and there, once again, a simple signpost, or they can just come and join the cafe, meet friends, and be connected that way. So once again, we're trying to think of as many ways as possible about communicating all that support that's out there. For those people for whom a simple signpost isn't really what they need, people can come in and work with one of our health connectors, and those will be people who have really sort of quite complex lives, who need a bit of support in actually finding out how to navigate things, so it's not just about how to link them up to things in the community. We worked with someone recently, for example, for who they couldn't make a phone call, and that was the thing that was blocking them, was actually having the confidence to make a phone call. So we worked with that person to build the confidence to make the phone call, because actually if we were saying to them, hey, let's set goals around how to get a job or meeting people, that was just not what was important to them. So as I hope you can see from here, our sort of social prescribing work, a lot of it isn't about come and see one person within our team. It's about actually how do we shine a light on all those fantastic things that are happening out there in the community. And a big part of our work that Nikolai was just talking about is our Let's Connect work. And we realized that actually website, phone line, social media, physical place that you can go to find out information, but actually human beings, all of us in the community, signposting and supporting each other is where the huge power is. So we have over 1,400 community connectors, and those are people who signpost friends, family, colleagues and neighbours to support in the community, so that they are almost in a way a website. They don't have to know all that information, they just know key bits of information. We've had a huge amount of media interest, and the media interest, whether it's in the British Journal of General Practice, whether it's in the Guardian, in the Telegraph, in Quartz or the BBC, it's simplified our work down into reduce loneliness and you can reduce hospital admissions. Actually, our work is part of a huge big jigsaw of lots of people working together, lots of different ways of working together, and it's not just as simple as do one bit of it and it works. It's actually all the community working together, all those bits of the jigsaw working together. One of our lovely health connectors drew this last night for me, because I said I wanted to illustrate the power of our Let's Connect work. If you can see the lady in orange underneath the signpost, so she's been trained as a community connector. As I say, we've got 1,400 community connectors. They're not volunteers, it's just active citizens. It's just all of us. Ideally, the whole town, the whole of Mendip could become community connectors. So that person is chatting to a friend, to somebody they've met, and also them sitting on a bench. And that person they've been sitting on the bench with, they've just signposted to the Talking Cafe. It's so simple. It's really just about letting people know the support that's out there. So we asked our community connectors, they have on average 20 conversations, 20 signposting conversations a year. So in a population of Frome, which is 30,000, if we have those 1,400 community connectors, they're having 28,000 signposting conversations a year. And it's not just about a cold website, but they're having those conversations with people who can make a difference to them, for people who that signpost is more live because they're hearing it from a friend or family or a neighbour. Next slide, please. So we've taken this next part of our work to what we've called Let's Connect. So we've got our social prescribing, our community development, that's mature, that's been going for a long time. But this power of word of mouth, we're really seeing is so important. So we've got our community connectors. We've noticed during COVID the importance of being digitally connected. So we've now set up our digital connectors, and we've set up that training along the same lines as our community connectors. It isn't about training experts, it's training people with knowledge to be able to pass on to people. So we've got the training package for our digital connectors. We've also got street connectors. So during COVID, when people have, all those amazing networks of support have popped up, we've said to those people, hey, in future, will you be our point of contact? So we've had people all over the place popping up saying, I will be the point of contact for my street. And this really isn't about having those people who are already active citizens. This is about having people, we've got one community connectors who is somebody who's housebound, who's a teenager, and he trained up to be a community connector. He's not your typical active citizen. He is someone who wanted to get involved, to be part of the movement. So it's really anyone can get involved. And we're thinking if we have these networks, so we have our community connectors, our digital connectors, our street connectors, we're working on having warm home connectors, and also people who can talk about planning ahead for when we become less well, all these multi-layers of connectors in our community. And you can be one of them, or you can be all of them. So you can do one bit of that training or all of the training. I'll speed up over this last bit and I won't go through to our walking taxis or our bench bus stops or our town of names, but these are all projects that we're working on. Just quickly, the benches, we were thinking that people meeting outside, do we know where those meeting places are? Let's map those benches across our town and let's have them kind of as bus stops. So that if people do want to either meet on those benches or maybe go from one walk from one bench to another bench, why not use that power of actually the environment, the community we're working in, to create some kind of meeting places, but also some kind of place of getting exercises. But just the final thing here, I found this amazing mental health booklet in Cumbria, and I contacted them and I said, can we use that during COVID? And they said, yep. Over 24 hours, we took all the Cumbrian information out, we put the Mendip information in. We have 47,000 households in Mendip. We put a word out to the community. We said, we've got these booklets, we've printed them with a turnaround of about a week. Can you help us get them out? We had all these volunteers, not formal volunteers, active citizens saying, I'll do it, I'll do my street, I'll do my street, I'll do my village. Within a week, we have those 47,000 booklets delivered by the community, for the community, had information on just general stress and coping with stress through to thoughts of suicide that went through everybody's door in Mendip. And that's the power of those people in the community. And it's not about us saying we're experts, we've got to do it. It's about saying, let's all work together, do things together and support each other. So if anyone wants to contact me, that's my our sort of general email address and our website and my phone number. So thank you.
Thank you, Jenny. There was an excellent whistle-top tour, which again, a bit like Denmark, is absolutely sort of years and years of work and toil and everything sort of compressed into sort of 15 very short minutes.